Hello, and welcome to Ethics and Liability in Home Health. Today, we're going to take some time to understand these important topics within the Medicare home health setting. This training video is intended for home health aides, nurses, social workers, and physical, occupational, and speech therapists who provide services to Medicare beneficiaries. First, let's take a moment to truly understand what it's like for a patient receiving home health care. A home health patient might be immobile or have mobility issues, have a mental illness leaving them confused, scared, or agitated, be experiencing a new and sudden illness, be recovering from surgery, be entering a new phase of illness, be dealing with an exacerbation of a chronic illness they've had for decades, such as diabetes or COPD. That's where you come in. Home health staff provide care to these individuals within their place of residence. You help keep them safe and might be the first to notice when something is wrong. You play a vital role in your patient's well-being. You may also be a member of a home health agency that is Medicare certified, which means your agency provides services that are approved by Medicare for Medicare beneficiaries. The agency is reimbursed by Medicare for these approved services. As a member of the home health team, you are accountable for both the patient's well-being and for following all of the required Medicare regulations. Healthcare workers can face ethical issues in every setting. This is especially true in the home, where the independence of both the patient and the care providers, along with limited supervision, can make identifying and dealing with ethical issues a challenge. For home health staff, ethical issues in the home may be due to patient care concerns, patient choice, family involvement, and compliance with agency policies and Medicare regulations. To understand the risk involved, the staff member must have an understanding of liability and ethics and be able to recognize and report potential ethical issues. Ethics. Ethics can be defined as the study of the difference between right and wrong. Ethics is closely related to human behavior, values, and morality. Ethical standards. Over time, many people have accepted basic beliefs about right and wrong. Those common beliefs are known as ethical standards or principles. Businesses are also guided by them. These common standards, as well as a person's own standards, guide the way a person acts. Actions can show a person's understanding of right and wrong and their beliefs about ethics. Home health care staff must also be aware of the ethical standards or requirements of their roles in their workplace. These standards are used to guide ethical actions while providing care. Healthcare professionals encounter situations daily that require ethical behavior and decision-making. These may involve patient care, families, or healthcare staff members' personal behavior. Additionally, sometimes there are Medicare regulations and legal requirements affecting the same situation. Think of the following examples. Patient care. When caring for patients, it's normal for healthcare workers to want to do the right thing. Following policy and procedure helps ensure that care is provided properly. However, patient care questions can occur. Healthcare workers often find themselves wondering how to support the patient's right to make choices when the patient is making a poor choice. Advance directives. Patients sign these documents to indicate their choices about care at the end of their life. These statements are signed in advance because the patient may not be able to make choices when they reach the final stages of illness. Healthcare workers are required by laws and ethical standards to follow advance directives. Patient mental status. There are a number of ethical questions healthcare workers must answer when a patient's mental status changes and the patient begins having problems making decisions and choices. To meet basic ethical standards, the team of care providers must often work together. Sometimes, obtaining legal advice is necessary. Families. Working with families also requires understanding ethical and sometimes legal standards. Personal behavior. In addition to ethical concerns about patient care, care providers must be aware of their own behavior as an employee. This includes being truthful when documenting care and reporting the number of hours worked. It also includes behavior towards patients and their families, as well as protecting property that belongs to the patient or the employer. Billing and finance. A healthcare organization's billing practices receive a great deal of attention. Organizations must follow ethical standards when billing patients and insurance companies, as well as the Medicare and Medicaid programs. This includes providing services only to those patients who meet the payer requirements and your accurate reporting of the time and type of services provided so that all billing is accurate. Every employee who is involved with billing or documenting care must act ethically. When unethical practices occur, individual employees and entire organizations are subject to being charged with fraud and other legal offenses. Compliance with laws. In addition to the regulations for accurate billing, home care agencies must meet many other federal and state regulations and requirements, such as accreditation standards for providing care. Home care agencies usually have a compliance plan, which explains how employees will meet these requirements. Working in home care, staff members are much more independent compared to working in hospitals and nursing homes. Working apart from supervisors and other employees, along with the increased time spent working with families in their own homes, can sometimes pose challenges. When faced with a potential ethical problem, there are steps you can take to help make the best choice. Ask yourself these questions. Does this feel right? Your common sense may tell you that there's something wrong. Does it follow policies, regulations, and laws? Unfortunately, sometimes policy and regulations might seem to get in the way of fairness or what feels right. But in these situations, it's important to talk to your agency supervisor to come up with a solution. The following are requirements for home health staff. It's critical to comply fully with these requirements as they help ensure that you are empowered with the knowledge needed to make the right decision. Even though you understand basic ethical standards, it's important to know how your agency includes those in its policies. Read your job description and ask questions about any requirements you don't understand. Stay up to date with changes in agency policies, especially those that affect ethical and legal requirements. Read each new message or policy change that is posted. Attend meetings and complete annual education requirements. This might include annual training about HIPAA, the agency's compliance plan, understanding Medicare regulations and what's covered, or identifying and reporting abuse. Avoid any appearance of unethical behavior by keeping careful records of the care you've provided, the time it took, and the correct mileage you drove. Complete agency forms immediately after providing care or completing a visit in a patient's home. Studies have shown that accuracy decreases as time passes between performing an activity and documenting the activity. Additionally, the standard of care is to document at the patient's bedside or during the visit, not afterwards. When you understand agency policies and standards, you will be better prepared to make good decisions about the care you provide, as well as respond properly to unexpected situations that you may face in a patient's home. Uphold professional behavior. Recognize that your own personal problems may affect your reactions to work requirements. It may be tempting to talk about your personal problems with patients and their families, but doing so places a burden on those who are already burdened with illness and their own problems. Ethical standards for doing good, treating patients fairly, and showing respect require that you focus your attention on them while in their place of residence. Offer support. Many patients have a need for emotional support. They may be lonely, dealing with a difficult diagnosis, or in pain. As a result, they may be weepy, over-dependent on you, or demanding. Keeping in mind that you want to do good, you will also need to balance requirements to allow the patient to make choices and to be fair to all patients. You can show your support by listening carefully when patients talk with you and by showing kindness through gentle touch and paying attention to details while providing care. Remember to remain professional. While you may feel as though you're a family member, you are not. Performing your duties in an ethical manner is easier when you maintain your separate role as a caregiver. Observe and report. Since you may be involved in ethical dilemmas at any time, or may see situations that appear to be questionable, it's important to observe for changes in a patient's physical status, changes in a caregiver's behavior, or changes in plans that patients may tell you about. Report these changes to your supervisor. In particular, if a patient tells you about a new advance directive or a change in how he or she wishes to be cared for, report this to your supervisor immediately.